Hello everybody, this is Dr. Marc at DuPéré, the Visage Clinic here in Toronto, beautiful Canada. Thank you for joining. I want to talk to you guys about breast implant. As you know, breast implant is probably one of the most common procedures that we plastic surgeons perform. I have here a nice silicone gel implant, the so-called gummy bear implants. Who are they for? First question. Now, those implants are commonly requested by different kind of ladies who want to have larger breasts. There are patients who are born with smaller breasts, or patients who have a B cup breast and they want a C or D cup breast. So that's one of our patients who may seek breast implant. Other types of patients may be the ones after breastfeeding, where the breast during lactation have grown to a large size and subsequently have deflated and often have sagged a little bit. So they will come for us to replenish volume and often for a breast lifting procedure called mastopexy. We also have patients who have an asymmetry. Maybe one breast has grown larger than the other one, and they'll seek a balancing procedure to achieve more symmetry. And we also have our transgender patient, male to female patients, who are looking for breast augmentation, and they'll seek some breast implant procedure. So those are kind of our four procedures, and that will also include the mommy makeover patients who also seek other procedures with the breast enhancement, such as tummy tuck, labiaplasty, pubic lift, etc. Now we have two main types of implants in Canada. We have the silicone gel, so-called gummy bear implants. We have also the saline filled implants, which are basically water filled. This is the saline we put in the veins when you go to the hospital. And they are also on the market because the silicone gel feel a lot more natural. They tend to be the most popular implants we use today. Implants can be placed in three positions in the breast. They can be under the pectoral muscle, which is the favored site for most patients. We can put them under the gland, and there's a layer in between called fascia where we can put them underneath as well. Fascia is a white layer that most muscles have, and we put them under the fascia if there are contraindication to going under the muscle. The favorite incision is still under the breast in the fold, as we avoid touching the breast tissues. We avoid also touching the breast ducts in the nipple, which may be related to a complication called capsular contracture. So different patient, different needs. We evaluate all the incision. There's also the underarm approach that we sometimes use if we know our patient does not scar very well. Recovery. So recovery depends on where the implant is placed. When we put implants, again rarely, but in selective cases, under the gland, there's very little pain, there's no muscle involved. The recovery is a lot faster, but we also have a slightly higher risk of contracture when the implant gets squeezed by the capsule that the body formed. We call it a capsular contracture or contraction of the capsule. So under the gland, but easy recovery. Under the muscle is again favored, but because we have to insert under the muscle, we have to detach the pectoral muscle slightly. That muscle is attached to your arm and you need it every day. There'll be some tenderness for 2, 3, 4, 5 days. So the recovery is a bit slower for that purpose. But again, it's favored, it's preferred, because the implant is kept like an internal bra. The muscle will support the implant longer over time. And also you get that 1 to 2 centimeter muscle layer covering the implant, helps to make it look and feel even more natural. And there's also a slightly easier mammography when the implant is behind your muscle, because yes, when you turn 45, 50 years old, you'll need mammography as any other ladies. Breast implant is again probably the top procedure we perform in our clinics here in Toronto. It's been used for many years. And at the office, we pride ourselves in using sizers, which I'd like to show you. In the past, we would put those implants in a bra, but when the lady would put in the bra, because of all the gaps that externally we get in an implant, we would get a fake comfortable size, meaning the patient will feel that this is big enough for her, but in real life, when it's inside, they are smaller. So we've gotten those nice sizers. They're not implants. They're really meant to try in a sports bra with no padding. So we invite our ladies to come to the clinic with a sports bra of the size they would like to go up to, no padding. And then we put them in the bra and they look in the mirror. And because it's meant to be sizers, there's no air, there's no gap, we get a very precise, almost perfect final look that they will get with our implant post-surgery. And because of those sizers, which come in all sizes, we do not have any ladies anymore who wish they had gotten larger or smaller. So we love our sizers. My patient can spend a lot of time with me and my nurses. They can bring their partners if they want to see them, to play with them. And once we get the size they like in the mirror, we can order comfortably and confidently the final implant size. I thank you for watching. This is breast augmentation surgery here with Dr. Marc DuPéré, Visage Clinic in Toronto. Thank you for watching.